Core Group Polio project globally started in 1999 using the approach of partnership with core group members and local members focusing on polio eradication activities. Currently, core group polio project working in 7 countries: Afghanistan, Ethiopia, India, Kenya, Nigeria, Somalia, and South Sudan.
Since the late 1980s, the use of supplemental immunization activities has been a key strategy of the Global Polio Eradication Initiative. Polio supplemental immunization activities are mass vaccination campaigns that aim to administer additional doses of oral polio vaccine to each child, usually aged less than 5 years, regardless of their vaccination history. Supplemental immunization activities are aimed at enhancing the limited ability of routine immunization activities to reach at-risk children with the number of oral polio vaccine doses required to generate immunity. Several countries provide supplementary immunization activities through home-to-home delivery strategies. Although considerable efforts have been exerted to wipe out polio from the face of the earth, there are still challenges to alleviate the epidemic, mostly in the developing world. Ethiopia joined the polio eradication effort in 1996 and was able to interrupt the endemic wild polio virus transmissions. The last case of the wild polio virus was isolated in Kambata zone of Southern Nations Nationalities Peoples region in January 2001. Several supplemental immunization activities have been carried out in Ethiopia under the leadership of the Federal Ministry of Health and auspices of different polio partners including Core Group Polio Project, UNICEF, WHO, Rotary, USAID, CDC, Bill and Melinda Gates Foundations, and others.
Ethiopia Core Group Polio Project started in 2001 and focusing on support of the effort of the government for polio eradication activities.
Core Group Polio Project in Ethiopia was established in November 2001, mainly to contribute towards polio eradication efforts of the Ministry of Health in pastoralist, semi-pastoralist, and hard-to-reach areas of the country. Core Group has been working in international and local project implementing partners in hard-to-reach and bordering waradas in 5 regions, namely Gambella, Southern Nations Nationalities Peoples, Oromia, Somali, and Benshangul Gumuz regions, focusing on community-based polio eradication initiatives and supporting routine immunization activities. Core Group Polio Project Secretariat and implementing partners are providing technical, financial, and logistical support during the pre-, intra-, and post-campaign activities in its project implementation areas.
Currently, Core Group Polio Project support the polio eradication activities in pastoralist, semi-pastoralist, and hard-to-reach areas, working with 9 international and local NGOs.
In April 2019, polio supplementary immunization activities have been conducted in Gambella region. In this campaign, Core Group Polio Project, with its implementing partners, the Ethiopian Evangelical Church Mekane Yesus, and International Rescue Committee, through the headship of the Gambella Region Health Bureau, have provided support throughout the campaign.
ካምፔኑ በጥሩ ሁኔታ ነው እየሄደ ያለው። በዚህ ካምፔን የተሳተፉ ፓርትነር ኮር ግሩፕ ፖሊዮ ፕሮጀክት ተሳትፏል። ኢስት ጋምቤላ ቤተል ሲኖዶስ፣ መካነ ኢየሱስ፣ IRC፣ ዩኒሴፍ፣ WHO፣ ሌሎች ብዙ ፓርትነሮች አሉ። እንደዚህ ክትባቱን የዘመቻው እንዲሳካ ከጎናችን የሆኑ ማለት ነው።
Core Group Polio Project Secretariat Office team and partner field staffs, together with the regional, zonal, and Warada Health Office, as well as polio partner NGOs, have attended the pre-campaign coordination and task force meetings held at the regional, zonal, and Warada level, which were held way before the campaign. The meetings were aimed to discuss the coordination of different subcommittees, such as logistics, communication and social mobilization, monitoring and evaluation, planning and coordination committees. The logistics committee was responsible for vaccine distribution, banners, posters, leaflets, assigning vehicles, and the preparation and distribution of formats. The Planning and Coordination Committee was responsible for the organization of trainings and orientations for campaign coordinators, supervisors, and vaccinators, while the Communication and Social Mobilization Committee organized social mobilization activities using banners, posters, leaflets, mobile vans, or even town criers, home to home using community volunteers, public gatherings at the marketplaces, religious ceremonies, coffee ceremonies, and the likes. During the intra-campaign activities, core group and partners have participated in the campaign launching ceremony, which was held at Abobo Warada, 4 to 5 kilometers from Gambela town, with the presence of higher government officials, health professionals, the vaccination team, children, parents, and other members of the community.
በአዎ ወረዳ ላይ የላውንቺንግ ተካሂዷል በተሳካ ሁኔታ። ከዛም ባሻገር ደግሞ ለምሳሌ በእኛ በኩል የትራንስፖርቴሽን በመስጠት በሰፖርት በማድረግ የኛ ኦፊሰሮች በወረዳ ደረጃ ሌቭል ደረጃ technical support በማካሄድ በመስጠት ላይ ይገኛሉ።
Furthermore, the project staff has participated in social mobilization activities and intra-campaign monitoring, that is, checking vaccine supply, tally sheets, checking house markings, figure markings to identify and vaccinate missed children during the campaign days and participate at daily evening campaign review meetings. During the post-campaign phase, house-to-house random convenience surveys were conducted after each campaign to estimate the proportion of children missed by the campaign, to establish the most likely reason why the child was missed, and to identify poorly covered and missed areas so these can be targeted with corrective actions. This survey is contracted to experienced independent monitors to guarantee the reliability and quality of data collection. At this session, results are discussed, further elaborated, and decisions will have been made on follow-up actions to improve subsequent rounds. The minutes of campaign review meetings will be shared with the national-level partners, who will provide feedback to regions or provinces. Compiled campaign reports are prepared by the vaccination team and submitted to the Warada campaign coordinators, who then send the reports to the regional health bureaus. The role of community members or health development armies in conducting effective supplemental immunization activities is very crucial.
Core group has very intense experience to mobilize the community. To effect this community participation, CGP has trained community volunteers and health development armies in its implementation areas. The trained community volunteers or health development armies, they have been oriented on social mobilization. So they mobilize the community in their localities to reach every child in their village. Some of them also being engaged in the registration of the eligible children so that no child has been missed.
They are trained by Core Group Polio Project and support the social mobilization activities towards ending polio.
Regarding the social mobilization using the religious and clan leaders, they are the gatekeepers of the community in their localities. So every message which is transmitted from or transferred from the religious leaders is very valuable by the community so that we sensitize them on the importance of the polio vaccine and administration of the polio vaccine. So after that sensitization workshop, the religious leaders, they mobilize or they transfer the message to their community so that every child is vaccinated and the leaders are part of that system.
More importantly, religious leaders in the areas have played a significant role in raising public awareness on the importance of the campaign during prayer times and other religious gatherings. Core Group Polio Project, through its Mainstreaming Polio Through Religious Institutions project, created partnerships and trained the religious leaders to support the polio eradication activities in its implementation areas. Similarly, community leaders and local non-governmental organizations have discharged their social responsibilities through the use of community-tailored messages during market days, public holidays, and other social gatherings.
ክትባት ሲኖር ያው ቀስቀሳ በማድረግ ያግዟቸዋል። በፖሊዮ ዘመቻም እንደዚሁም መደበኛ ክትባትም ሲኖር አብሮ ከነሱ ጋር በመሄድ እንትን ያደርጋሉ። ሌላው ደግሞ በማናቸውም አጋጣሚ በሚያገኙት ስብሰባ ለምሳሌ የቀበሌ ስብሰባ በመኖርበት ሰዓት በእሁድ አምልኮ የክትባት መልእክት በማስተላለፍ ተሳትፏል። ሌላ ደግሞ በቡና ጠጡ ሴቶች ከ10 በላይ ሆነው ቡና ይጠጣሉ። ስለዚህ ይህን አጋጣሚ በመጠቀም በጣም ለውጥ ማምጣት ችሏልና እነዚህ በጎ ፈቃደኞች የሚፈልገውን መልእክት ያስተላልፋሉ እዛ ከዛ ውይይት ያደርጉበታል ማለት ነው።
Ethiopia has secured its polio-free state. This effort is mainly the result of the hard work done by the government of Ethiopia and the support of development partners. As one of the supporters of the polio eradication effort, Core Group is grateful for the support provided by its staff members and project implementing partners. Although immunization campaigns appear to have met the objectives, there's still a long way to reach the unreached children. Campaigns need to reach children living in inaccessible areas and at the transit points with vaccinations. It requires the intensification of all efforts, coordination, and dedication of all stakeholders in the upcoming polio eradication interventions to kick polio out of Ethiopia. Core Group Polio Project strongly believes that together we will achieve the goal of eradication that the nation seeks.